is behavior pain-based or is it behaviorally based? And I both love and hate this question. I like it when it is posed as a question, because it's making us consider all of the options. Is this person who does not have a well-established communication system, and we might have a high pain tolerance. Are they uncomfortable? And how do we figure that out? And so it's really important for us to pause and ask the questions about how are they when they're healthy? What does that look like? And what is this difference? So that helps us know if you have a baseline behavior that includes chronic challenging behavior, how is this behavior different? And that helps us look at it both medically and psychiatrically. But we have to really understand that discomfort reduces coping for me and for you and for pretty much every human that I know. And you're more likely to have an increased behavioral reaction when frustrated if you're uncomfortable. And so we still want to treat during medical care or if somebody's hurting. And this is a thing I coach families on all the time because they'll come in and their child is found to be sick. And we certainly adapt behavioral intervention to illness, right? I'm not going to expect you to do the same level of activities and things that I might when you feel well, but we still want to make sure we don't just give in to everything. Even though that can be what my heart wants to do, we do find that sometimes then the behaviors don't go away as easily, even when the individual feels better. So it is really important to continue what I tell parents is you got to still parent through the illness to help keep things on track so that we don't go backwards behaviorally. Because once you're well, we want to make sure we're moving forward in the right way. And I'm having this conversation right now. We had she's an adolescent autistic adolescent who has needed numerous cleanouts, and she was, and they're tough for her, but she came in really sick and she ended up being diagnosed with colitis. And so she got a lot of treatment for this infection, and she's going to need ongoing kind of support and care for that. And so GI is very involved with her. And she already had a very limited diet, but would eat a variety of what I'd call kid-friendly foods. But she had a nasogastrous tube, and she was both cleaned out, and then she got nutrition through that. Which she actually tolerated because she was so sick. And she's gotten better at tolerating that. And then as they started to introduce food again, she really wanted chips. And so her mom was giving her chips, but it got to the point she was eating like 11 bags of chips a day because she just got really stuck on chips. And then she didn't want other food. And so to help her be more open to other foods, we need to get rid of the chips. But mom was like, but she's sick. I just want to feed her what she wants. But I'm like, it's not nutritionally sound, and there's a lot of things. So we've been having a lot of discussion because the longer you go of just feeding her chips, the more I'm afraid she'll be stuck on just wanting chips because she has that, she tends to have that really intense interest in things that can really persist.